Good afternoon, all. Today I will be presenting my paper on study of adherence to intravitreal anti-VEGF injections in patients with diabetic macular edema. So, as you all know, the incidence and prevalence of diabetes mellitus is on rise, leading to increased incidence of diabetic retinopathy, resulting in increased incidence of diabetic macular edema, which invariably leads to requirement of multiple intravitreal anti-VEGF injections. And the 5 dimensions of adherence according to WHO are therapy-related factors, patient-related factors, condition-related factors, health system, and socio-economic factors. The aim of my study is to identify the elements impacting patients' adherence to follow-up appointment and the reasons for non-compliance with intravitreal anti-VEGF injections. Coming to objectives, to investigate the relationship between the demographic data and their adherence to the intravitreal anti-VEGF injections, and to understand the extent to which the knowledge about the disease influence their adherence, and to gain insights into perceived seriousness, susceptibility, benefits, and barriers associated with diabetic macular edema. Coming to methodology, patient comes to vitreoretinal department and is a known case of diabetic macular edema who has already taken more than or equal to 2 intravitreal anti-VEGF injections, and the consent is obtained and questionnaire were administered. My questionnaire consists of 3 sections. Section 1 includes demographic details, and Section 2 includes knowledge about diabetic macular edema, and Section 3 about health belief model, which includes questions regarding to perceived seriousness, perceived susceptibility, perceived benefits, perceived barriers, anxiety and pain, cues to action, and self-efficacy. Coming to results, out of my study population include 250 patients, out of which 71% are male and 29% are female, and most of them belongs to a middle class. And 29% of the study population are free patients who get a subsidy of 2/3 amount of the treatment cost, and 71% are paying patient, and out of which 32% are insured and 68% paid from their pockets. The average cost of injections borne by the patients is about 2/3 of total amount of total expenses borne by the patient, and the distance traveled and the time traveled by the patient is 76 kilometers and 2 hours respectively. The majority of the study population received Avastin, which is followed by Tricot. Coming to knowledge, about 80% of the total study population has a good knowledge about the disease, and 4.3% has no knowledge about the disease. And around 1/4 of the study population agreed that diabetic macular edema is a sight-threatening disease and will interfere with their daily activities. Around half of the study population were concerned about the visual loss due to diabetic macular edema and recognized the importance of regular follow-up. In around half of the study population felt that regular follow-ups and injections were useful and stabilized their visual acuity. Around 1/3 of the patients perceived that positive effects on their daily effects due to intravitreal anti-VEGF injections. Coming to perceived barriers, the barriers for adherence in our study, in the present study, includes difficulty in follow-up dates, unaffordability of injections, transportation, fear of injection, impeding general health of the patient. Over a period of time, the anxiety and the fear of getting injection in the subsequent time has decreased. Around 73% of the population got injection because of being prompted by the treating doctor, and getting a repeated counseling. Even though there are many factors for non-adherence, more than half of the patients wants to get a regular follow-up and regular injections if needed. Coming to discussion, the main factors for non-adherence in my study are remembering follow-up data in follow-up dates is 84%, and too many injections in 83%, painful procedure in 80.8%, and fear of injections in 71.6%, unaffordability in 60.8%, and transportation in 60.6%, and impending general health in 63.6% of study population. Coming to conclusion, a tailored educational efforts regarding the comprehensive understanding of the disease, the options available for the treatment, and the benefits of the treatment should be should be explained to the patient, and improved pain management strategies like relaxation techniques and distracting methods should be used, and adopt a treat and extend regimen providing the same visual outcome with lower number of consultations for the patients who cannot follow monthly regimens are used, and financial assisting resources, since diabetes is not only related to ophthalmology, it also it also includes other specialties, and convenient scheduling should be given to the patient. These are my references.
Any questions, please?
Can I ask? Yeah, so you have various data, and you have, in the starting, you started with something else and ended with something else. So you said there is insurance, you said free patients. So did you look at that those patients were coming for follow-up better than the paying patients, or multiple visits? No, when we are supporting the patients, are they coming for better follow-up, or are they not coming for better follow-up?
They're coming for better follow-up.
But that's not shown in the results, right? There's too much of data which was scrambled into a shorter period. Thank you.
One question, like regarding why the patient would not turn up. Like in the questionnaire, was the question included like after first injection, if there is improvement, so that also patient.
No, sir, I didn't ask that.
Because that is like a very common
Exactly.
I think